A kidney stone can announce itself in a way that is hard to ignore. You may feel fine, then suddenly develop intense pain along one side of your back just below the ribs. The pain may rise, ease, and return in powerful waves. As the stone moves, the discomfort can travel toward the lower abdomen or groin, making it difficult to sit still. A kidney stone is a hard deposit that forms from substances normally dissolved in urine. Your kidneys filter the blood, remove waste, balance fluids and minerals, and produce urine. When urine becomes too concentrated, substances such as calcium, oxalate, or uric acid may begin forming tiny crystals. Those crystals can gradually join together and become a stone. A stone may remain inside the kidney without causing symptoms. Pain often begins when it enters the ureter, the narrow tube carrying urine from the kidney to the bladder. The ureter contracts as it tries to push the stone forward. If the stone slows or blocks urine flow, pressure can build behind it, creating severe wave-like pain. The symptoms can change as the stone travels. Pain may begin in the side or back, wrap around the waist, and move lower over time. Nausea or vomiting can occur because intense pain activates the body's stress response. You may also feel a frequent urge to urinate, pass only a small amount, or notice burning. Urine may appear pink, red, or brown if the stone irritates the urinary tract and causes bleeding. Kidney stones and gallstones are not the same condition. Kidney stones form in the urinary system and often cause side, back, groin, or urinary symptoms. Gallstones form in the gallbladder and more commonly cause pain in the upper right abdomen, sometimes after a meal. So do not assume that every episode of severe side or abdominal pain is a kidney stone. A urinary tract or kidney infection, appendicitis, gallbladder disease, intestinal problems, ovarian conditions, pregnancy-related complications, and other urgent issues can feel similar. Symptoms alone cannot confirm the cause. A healthcare professional may use your history, an examination, urine or blood tests, and sometimes imaging to determine whether a stone is present or urine flow is blocked. Treatment depends on the stone's size, location, symptoms, and whether infection is involved. So why do some people develop kidney stones repeatedly while others never experience one? The answer begins with understanding that kidney stones are not all made from the same material. Kidney stones are not a single disease with one cause. The most common type contains calcium, often combined with oxalate, but stones may also form from uric acid, minerals linked to urinary infections, or rarer inherited conditions. That difference matters because advice that helps one person may not be right for another. One major risk factor is concentrated urine. When there is less fluid available to dilute minerals and waste products, crystals form more easily. But this does not mean everyone should force down the same number of liters each day. Fluid needs vary with body size, climate, exercise, pregnancy, medications, and medical conditions. Someone with heart failure, advanced kidney disease, or another fluid-sensitive condition may need guidance from a clinician. Diet can influence risk, but the details are often oversimplified. A high sodium eating pattern can increase urinary calcium levels, which may raise the chance of certain stones. Large amounts of animal protein may also affect urine chemistry, especially in people prone to uric acid stones. Still, blaming one food such as red meat, dairy, spinach, or soda misses the full picture. Portion size, overall diet, stone type, and personal history all matter. Calcium is a good example of why context is important. Because many stones contain calcium, some people stop eating calcium-rich foods. For certain calcium oxalate stone formers, getting an appropriate amount of calcium from food can help bind oxalate in the digestive tract before it reaches the urine. Calcium supplements are a separate question and should be discussed with a healthcare professional. Risk may also be higher with a family history of stones, a previous stone, obesity, gout. recurrent urinary infections, or digestive conditions that change nutrient absorption. Some digestive surgeries can affect risk. Certain medications and supplements may contribute, so a complete medication list is useful during evaluation. None of this means a kidney stone is simply the result of a personal mistake. Genetics, metabolism, medical conditions, diet, and hydration can interact in complex ways. After a stone passes or is removed, laboratory analysis may identify what it is made of. Blood or timed urine testing may reveal patterns that can be changed. That information can turn generic advice into a more precise prevention plan. Knowing the stone type helps people avoid unnecessary restrictions and focus on the changes most likely to matter. Once you know that kidney stones have different causes, the next question is what actually helps prevent another one? The safest answer is not a miracle drink or a single food. So prevention usually depends on steady habits, the type of stone you form, and medical guidance. For many people, drinking enough fluid is an important first step because it keeps urine diluted. But there is no single amount that is right for everyone. Your needs may change with body size, exercise, climate, pregnancy, medications, and heart or kidney conditions. Try to avoid long periods of very dark urine unless your clinician has set a fluid limit. Lowering sodium can also matter. A high salt diet may increase the amount of calcium released into the urine, raising the risk of certain stones. Reading labels and limiting heavily processed foods are simple ways to reduce intake. Another common mistake is cutting out all calcium. For many people who form calcium oxalate stones, normal food-based calcium can help because it binds oxalate in the digestive tract. Calcium supplements are different and should be discussed with a clinician. Protein choices may matter as well. Large amounts of animal protein can change urine chemistry in some people, but that does not mean everyone must avoid meat. Balance is more useful than extreme rules. What about lemon water? Citrus contains citrate, and citrate may help reduce the formation of some stones. But lemon juice is not a guaranteed treatment, and it should not be described as something that dissolves every stone. It may be one useful part of a broader plan for selected people. Acidic drinks can also worsen reflux and affect tooth enamel. Claims that apple cider vinegar, basil, honey, coconut water, or pomegranate juice can melt kidney stones, detox the kidneys, cure infection, or control uric acid need verification. These foods may fit into a healthy diet, but they are not substitutes for diagnosis or treatment. Herbal products and supplements can interact with medications, and some may be unsafe for people with kidney disease. The best prevention plan often starts after a stone is analyzed or urine testing identifies a pattern. That information can show whether you need to focus more on fluids, sodium, calcium, oxalate, uric acid, or another factor. Most importantly, no drink or home remedy should delay medical evaluation when pain is severe, persistent, or accompanied by fever, vomiting, difficulty urinating, or other warning signs. When a kidney stone is confirmed, treatment depends on what the stone is doing, not simply on the fact that it exists. Some small stones may pass on their own with monitoring, fluids, and pain control. Others may need medicine, follow-up, or a procedure. The safest plan depends on the stone's size, location, pain level, whether urine flow is blocked, kidney function, and whether infection is present. A healthcare professional may use urine tests, blood tests, or imaging to answer those questions. Imaging can show where the stone is located and whether it is causing swelling behind a blockage. Urine testing may look for blood or infection, while blood tests can provide information about kidney function. If a stone is small and there are no signs of infection or serious obstruction, a clinician may recommend watching for it to pass while controlling symptoms. Some patients may receive a prescription medicine to relax part of the urinary tract and improve the chance of passage, but that choice must be individualized. Do not take someone else's medicine or start a product marketed as a stone remover without medical advice. Larger stones, stones that do not move, or stones causing persistent blockage may require procedure. Treatment may involve breaking the stone into smaller pieces, removing it through the urinary tract, or using another approach selected by a urology specialist. A procedure is not always the first step, but it should not be delayed when blockage, uncontrolled symptoms, or infection makes intervention necessary. Certain warning signs require urgent care. Seek medical attention if stone-like pain occurs with fever or chills, difficulty or inability to urinate, repeated vomiting, fainting, confusion, severe weakness, or pain that is worsening or cannot be controlled. Urgent evaluation is especially important during pregnancy if you have only one functioning kidney, or if you have kidney disease or a weakened immune system. A blocked urinary tract combined with infection can become serious, so fever with urinary pain should never be treated as a routine home remedy problem. Lemon water, vinegar, herbs, supplements, or products promising to dissolve every stone cannot show whether urine is blocked or infection is present. After the immediate problem is managed, ask whether the stone can be collected or analyzed. Follow-up testing may help identify why it formed and what changes are most useful for prevention. That may include guidance about fluids, sodium, calcium, protein, medication, or another risk factor. This is general health education, not personal medical advice. The practical message is simple. Get the right diagnosis, treat urgent problems promptly, and build prevention around your stone type, not around a miracle claim.